Hello, I'm Mark Weiner, President and Chief Executive Officer of Community Mercy Health Partners. After many attempts over the past 2 decades, our community's 2 hospitals finally came together in 2004. This merger was based on a shared vision to build a new state-of-the-art hospital. And since that time, our employees, physicians, volunteers, and community leaders have been united in the quest to carry out that vision. The day has finally arrived. In one of the largest civic projects that this community has ever seen, we have opened the new Springfield Regional Medical Center. This medical center is going to afford the community the opportunity to enjoy state-of-the-art facilities designed for healthcare today, and it's built with the flexibility and expandability to accommodate technology and services that literally haven't even been invented yet. What you're about to see is something that rarely happens, maybe once every 100 years. Not only the merger of 2 full-service hospitals into one, but the moving of 124 patients in less than 8 hours. This is the culmination of many years of hard work and dedication of so many people. This story is truly one of the most significant and meaningful historical events ever to occur in Springfield, and it's being told by the people who lived through it.
It's above and beyond all of our dreams, and it's a fruition of a lot of people's efforts over many, many years. We're very, very happy with how things turned out.
Personally, I'm going to be able to deliver better care, more efficient care. We're not going to have to walk quite so far. In the old hospital, we were going here and there because you couldn't get there from here. And now everything is so centralized, it's going to be easier for all of us to take better care of our patients.
I think this is a wonderful thing for Springfield and for the medical community. This is state of the art. I've toured it, and you aren't going to find any better facility anyplace.
It's going to bring modern day medicine to the community and allow us to attract more young qualified specialists to come and maintain the good quality of care that we've had in our community for some time.
This will also, the location will revitalize downtown, which is this town needs. And I think it'll be a great boon for the town.
The quality of this facility, I've never seen anything like it. It's second to none, not only in Springfield, but or in the Miami Valley, probably anywhere around the country.
My father was in the very first class of interns when City Hospital was brand new in 1934, and I've been a board member going back to 1978 at Community Hospital, so it means a tremendous amount to me personally.
This is as good as healthcare gets on the planet right now, so we are very, very lucky. And all the things that can spin off this, you know, the fact that the hospital's downtown, the economic development impact that has, the attraction of healthcare providers that the state-of-the-art facility brings.
Business people in this community talked for 30 years. We knew the right thing to do was to merge the 2 hospitals. We're just glad that we've come to this day with a new facility, state-of-the-art, and what the best thing of all is it should improve the health care for every citizen of Clark and Champaign County.
This gives a revitalization to this community. It's located in such a way that it enhances our community in the downtown area and will focus people in coming to the downtown and not only using the facilities here, but whatever else we're able to attract in downtown.
This is unbelievably cool. This is the culmination of dreams. This is folks who wanted to work together and found a way to do that over a couple of decades of conversation and found a way to come together, not just in a new building, but in a new kind of concept of care, which is a real focus of care and a single network of care across Springfield that, you know, is really meant to improve the health of the citizens of Springfield. So this is the centerpiece, but it's surrounded by tentacles of care that go to all aspects of what we do. And so I just think this is a remarkable day in a remarkable city, and will provide remarkable care. I just think it's incredible.
So excited. It's a new hospital.
hospital's finally here. We're all ready to move.
I'm anxious to see what's going to happen.
I don't think I'm telling anyone in this room anything that's not obvious to you all. All eyes of the community are on us today. There are tremendous expectations. We have all trained hard, we've drilled hard, we've practiced hard. We've done mock drills, we've gone through Joint Commission, we've gone through expected and unexpected surveys, we've gone through all sorts of calibrations and recalibrations. We've put in a lot of long hours. Many of us have done a lot of double shifts, overtime, but it all is coming down to today. And the community is expecting, the community deserves a first-class, full-service, faith-based, nonprofit hospital, and we're about to provide it to them.
What we're about to do
is allow Springfield to enjoy the newest, most modern, most technologically advanced, energy efficient, aesthetically pleasing 254-bed community hospital.
I want to call your attention and ask you to stay focused on one thing. And what would that be? Thank you so much for having that come off the tip of your tongue so quickly. There is not a wrong decision when the patient is in the middle of your decision making and your focus. So when you get rushed, take a deep breath, say what's best for the patient. That's the first thing you need to ask.
We're about to move our first patient from the Springfield Regional Medical Center on High Street campus to our new Springfield Regional Medical Center downtown. And we're very excited about it. It's mom and baby and dad, and they are just as excited as we are. So this is a monumental day for Springfield, and we're really optimistic about the new level of care that this hospital will be providing for the community.
Just getting him over there and situated and make sure he's healthy and everything checks out and he's good to go. You know, have that feeling like we're the first ones, one of the first ones to be in there.
To walk in there, yeah.
Yeah.
I'm excited to see what it looks like.
Hi Gretchen, I'm Yvonne. I'm going to be your nurse through the transport from here to the new hospital. Okay? So we're getting everything ready for you and we'll be over there and we'll be safe and sound, okay?
Okay.
This is absolutely a landmark day. Very few communities in the United States are blessed with a new hospital that is a state-of-the-art facility reflecting all the best practices, not only in construction, but in patient care delivery. Coupled with the new building, we are launching an electronic patient record today that is considered state-of-the-art worldwide, and we're excited about that. It will be a tremendous enhancement to patient safety, and it will facilitate care being provided by our nurses and physicians.
I'm real excited. Everybody's real excited, and to see the way, you know, everybody reacted when the lady came in, that was a lot of fun. She was really surprised, the first patient. But yeah, I've had bittersweet thinking about it because I've been over at the other hospital for 25 years. So, but this is all worth it.
Well, everybody's in different t-shirts and on different teams because they each have a specific job, and that helps you to quickly identify whose jobs are supposed to be what. It's helped organizational-wise because it takes a large amount of responsibility and puts it into a small amount at a time, breaks it up very easily. So each group knows specifically what their job is to do. They're not overwhelmed with a big picture. They can focus on exactly what it is that their group needs to do.
So the building of a brand new state-of-the-art hospital in downtown Springfield is sort of a revitalization of the entire city and the entire county. So I believe with this structure standing here, Springfield and Clark County is back to life again.
You know, I think Springfield is really lucky to have this, and I don't think that
that everyone realizes just how lucky, because it's phenomenal, and it's been a long time coming. I think everyone's going to benefit from it.
Our job is to be sure ambulance is available, that it's the correct ambulance for the correct patient, that they're going the correct style of transportation, that wheelchair versus stretcher, and to notify the team across at the new hospital if there's any change in the order of the patients arriving.
To have a state-of-the-art facility to operate in, an emergency department that's not pieced together with all private rooms and an adequate amount of space to see our patients in. It's a wonderful improvement for us and for the community.
I don't really enjoy coming to the emergency room, but being here, it's a really nice place, and the care they give is really good. They're really good people.
This is definitely a once-in-a-lifetime thing for me. I've been a nurse for 20-some years, so I will probably never move to a new hospital again. It's kind of like it's hard to believe that it's really happening, because it's been talking, we've been in this adventure with, with Mercy and community since 2000, so it's kind of hard to believe that the day's actually here and we're actually packing up and we're leaving.
This is us right here. This is the renal unit. This would be the entrance, the main entrance with the turnaround drive. This is the admissions desk. So you just get to 1 North by coming in the main lobby and walking right back. Plus we're orienting the patients to where they're actually going to be going when they leave here, what room they'll be going to, and if they'll have a room with a view, or when their family comes to visit them after 4 o'clock today, how they can access their unit from the main entrance.
The move is going exactly as planned. We're running on schedule. We're being very cautious with our patients. Patient safety is our utmost concern, and we've had no surprises. It is playing out just as we thought it would, and we're following our script.
I think one of the key contributing factors to the success that we've experienced today is, number one, the enthusiasm, the excitement, and quite honestly, the passion that all members of our team have displayed towards this move. People are enjoying what they're doing, and it's all contributing to a very positive experience for the patients.
Hey, Gretchen, you made it. It's wonderful. Congratulations being the first patient on the birthing center.
We're also learning a new EMR, where we've gone from completely paper to completely computerized, and that's a little bit intimidating, especially to old dogs like myself. Teaching an old dog a new trick is challenging. But I feel so far the experience in the first 4 hours of the move has gone well. We have lots of outside help from people who are well versed in the new computer system. And so far things have gone remarkably smoothly.
And it's just neat to see us as a community come together and be under one place and operating as one unit of people to minister healing to the community, and I think it'll be a beautiful thing to just all be working on the same page under one place.
Staff are extremely excited about it. The training and the preparation has obviously paid off, and we're providing a high level of care with great service.
The board is excited to see this day finally come. So we appreciate all the hard work that has gone into making this be a very smooth move and transition.
We have an exciting, cutting-edge hospital. This is the culmination of moving a community hospital to a technically superb, accessible hospital for everybody to receive care, irrespective of their ability to pay.
Why was our move into the new hospital so successful? The key contributing factors were the enthusiasm, excitement, and quite honestly, the passion that all members of our team displayed towards the move. This is arguably one of the best civic enhancements to the community in modern history. So with that, I say, this is our time. This is your time. And let's welcome the next generation of state-of-the-art healthcare for Clark and Champaign counties.